Hello everyone. After a long gap, let's restart our academics in relation to pediatric, and this is the best topic to restart the academics, that is immunization 2026. What's new? As per IAP, SCVIP recommendation, what's new about our immunization practice? Let's start. At birth, what are the vaccines to be given? We know BCG, OPV, and hepatitis B. Then at 6 weeks, 10 weeks, at 40 weeks, 3 times we have to give the same vaccines. We can give DPT either wholesale pertussis or acellular pertussis, along with that IPV, HIP, and hepatitis B. Then along with the DPT, IPV, HIP, and hepatitis B, we will give Rota and PCV, that is pneumococcal conjugate vaccine. The vaccines what we are giving at 6 weeks, the same thing we can repeat. We have to repeat at 10 weeks and at 14 weeks. Then next we'll call the infant at 6 months. 6 months what vaccine we can give? That is influenza 1. And after 1 month we'll give influenza 2. Here there is a change, we'll discuss later. The quadrivalent influenza what we are giving previously, now it has been changed to trivalent influenza. Then between 6 to 9 months we can give typhoid conjugate vaccine TCV, and there is no booster required as of now. Then at 9 months, what vaccine will give? We'll give MMR first dose. Along with the MMR, in certain cases, certain conditions, certain endemic areas, we can give meningococcal conjugate vaccine MCV. That we will discuss later. After that, we'll give at 12 months we can give hepatitis B. With hepatitis B, we can give in certain endemic areas, we can give JE, Japanese P encephalitis vaccine. We can give JE vaccine at 12 months completed. Then next, after 1 month, we can give second dose of JE vaccine. Then as per IAP, we can call the baby at 15 months completed, that is just 16 months, we can give MMR second dose, we can give varicella first dose, and PCV booster, pneumococcal conjugate vaccine, we have already given at 6 and 14. Here booster is allowed at 15 months of age. Then after 16 to 18 months, we can give the DPT booster 1. DPT first, second, third, we have given at 6 weeks, 10 weeks, and 14 weeks. Here comes the booster, first booster of DPT. Along with the DPT booster 1, we can give HIP booster 1 and IPV. Then at 18 to 19 months, we will give hepatitis A second dose. Hepatitis A first dose we have given at 12 months completed. Then after 6 months of the hepatitis A, we can give hepatitis A booster dose. Suppose we are giving live hepatitis A vaccine, then no need to give the second dose of hepatitis A. This hepatitis A first dose, second dose is for your kill vaccine. Then second is varicella. Last year we have revised that varicella what vaccine we have given at 15 months. Previously we were giving at 4 to 5 years, but recently they have changed that after 3 to 6 months of the first dose, the second dose of the booster dose of varicella should be given. So we have given the varicella at 15 months completed. Now at 18 months we can give the second dose of varicella. Then yearly we have to give influenza vaccine till 5 years of age, and at 4 to 6 years for booster we can call the baby at 4 to 6 years of age. Here comes the booster about your DPT second booster. First booster we have given at 16 to 18 months. Here is the path for second dose of booster of our DPT vaccine. Along with that, we have to give IPV second booster. This has been added previously, that IPV second booster to be given at 4 to 6 years of age. Along with that, MMR third dose. So what are the vaccines to be given at 4 to 6 years? This is DPT second booster, IPV second booster, and MMR third dose. Then after that, after 9 years completed, 9 to 15 years, some vaccines to be given. 10 years we can give DPT, not adult pump. That the dose is, that is called TDAP, the capital DPT, that is allowed up to 7 years. After that, if you are going to give DPT, then we have to give TDAP. So if we were giving the booster of DPT at 10 years, we have to give TDAP. And same thing to be repeated at 15 years completed, that is 16 years of age. Here another change at 9 to 15 years. Previously, what we are giving HPV 2 doses, 0 and 6 months. Now they are telling in case of immunocompetent girls, single dose of HPV can be given. This is as per WHO. This is the change. As per WHO, we can give single dose of HPV, but in case of boys, we have to give 2 doses, 6, 0 and 6 months of age. Then at 15 to 18 years, 15 to 18 years, suppose you are giving HPV, you are giving irrespective of the whether you are giving to a boy or girl, the dose is 3 doses, 0, 2 months and 16 months. This is the latest. What are the new things? New thing is at 9 years we can give to immunocompetent girls single dose of HPV. What is the new things? New things is we can give influenza quadrivalent vaccine. Some new things that we will discuss. New things in as per SCVIP in 2026. What are the new things? New things is recommendation of replacing your quadrivalent influenza by trivalent influenza vaccine. Previously, quadrivalent influenza that contain A, H1N1, S3N2, B Victoria, B Yakamata. But they have taken out that B Yakamata part. Now they are telling we have to give trivalent influenza vaccine after 6 months. Second thing new is use of nirsevimab for respiratory syncytial virus for high risk cases. This is the new thing we will discuss. Third thing, immunocompetent girls between 9 to 15 years may receive single dose HPV vaccine. This is the new thing. Fourth thing is a 5-dose intramuscular rabies vaccination schedule to be administered on 0, 3, 7, 14 and 20 days. This is the new recommendation this is the uniform recommendation for post-exposure prophylaxis along with rabies immunoglobulin or rabies monoclonal antibodies based on category. That the category 1, 2 and 3, just licking category 1, scratch without blood is category 2, scratching with oozing of blood is category 3, and immunoglobulin or rabies monoclonal antibody that is indicated in category 3 case of rabies bite, where we along with this rabies immunoglobulin and monoclonal antibody, we have to give the uniform IM rabies vaccination schedule on 0, 3, 7, 14 and 28. 5 doses to be given. These are the 4 new things they have said as per SCVIP in current 2026 schedule. What are the other optional vaccines? Let's discuss about some other optional vaccines. That is one thing is MCV, meningococcal conjugate vaccine. We have discussed that MCV can be given at 9 months completed along with MMR. But there are two brands. One is Menactra, one is Menbio. Menactra is recommended after 9 months. But Menbio, if you are giving, it is recommended after 2 years of age. Suppose we are giving Menactra and we have started between 9 to 2 years. We have then 2 doses of Menactra to be given 3 months apart. But Menbio and Menactra both are recommended as single dose after 2 years. Suppose we are giving after 2 years, we are giving Menbio or Menactra, then single dose is sufficient. But less than 2 years, if you are giving only Menactra is indicated, that is to be given 2 doses 3 months apart. Next is that nirsevimab. This is the RSV respiratory syncytial virus monoclonal antibody. Previously, we were giving palivizumab, but there are certain limitations. There is a need of monthly dosing. There are some logical issues, some cost-related issues. To overcome that, they have come with this long-acting molecule, nirsevimab, which the indication is preterm infants less than 32 weeks with the risk of bronchopulmonary dysplasia, less than 24 weeks with congenital heart disease, with neuromuscular disorder, certain high-risk cases where we can give one option to the parents that this molecule can be given in order to prevent them from the bronchiolitis that is caused by this dangerous virus, respiratory syncytial virus, that can be given, but with one-to-one discussion with the parents because it's a costly molecule. Dose is, suppose you are giving to a baby less than 5 kg, dose is 15 mg. If suppose his baby weight is more than 5 kg, then 100 mg to be given IM, 0.5 ml. that is to be discussed with the parents, and this molecule can be given to the baby. Next is about Japanese encephalitis vaccine. For Japanese bee encephalitis, there are some strains available in our country. The live evidence cell culture derived SA1442, that is indicated in our NIS program. We are giving 2 doses. First dose at 9 months and second dose at 16 to 18 months. But in private practice, what we are giving, that is inactivated cell culture derived SA1442, that is G vaccine. The dose is after 1 year it is allowed. We can give between, if you are giving between 1 to 3 years, the dose is 3 microgram to be repeated after 1 month. Suppose age is more than 3 years, then dose is 6 microgram to be repeated after 1 month. Similarly, inactivated varicocele culture, another vaccine brand is there, that is Genvac. It is indicated after 1 month, 2 doses, 4 weeks apart to be given. So these are the few changes what we have discussed as per ACVIP, the quadrivalent, about the quadrivalent influenza vaccine, about the Nirsevimab, about our this is the molecule, about the quadrivalent influenza vaccine to be replaced by your trivalent influenza, about our Nirsevimab for respiratory syncytial virus high risk cases, about your HPV vaccine, immunocompetent girls can be between 9 to 15 years, maybe given 1 dose, and about our 5 dose rabies vaccine 0371428 along with rabies immunoglobulin / rabies monoclonal antibody. This is the new thing. Thank you. Please subscribe to my channel and share it. Thank you.